Today I saw a patient in my OPD for whom we were suspecting breast cancer, and I told her that we have to do certain tests, we have to do a scan, we may have to do some blood tests, and we have to do a biopsy to confirm the disease. And she immediately told me that, doctor, please do all the tests except a biopsy, because I've heard that biopsy can spread the cancer. Now this is a valid concern that she had, and it is a common concern among a lot of people that will doing a biopsy spread my cancer. Now let's understand how cancer actually spreads. It is mainly through the blood as well as the lymphatic system that the cancer spreads. It does not spread either with a biopsy needle or via air. So this is a misinformation which has been spread by a lot of people who have not much knowledge about the subject, and they are not experts in this field. So I am here today to dispel this myth that biopsy can spread cancer. So biopsy is absolutely essential for us to first identify whether we are dealing with a cancer or some benign condition. And if we identify that it is a cancer, we need to identify what type of a subtype of cancer we are dealing with so that we can plan the treatment accordingly. Think about it. If biopsy would actually spread cancer, then doing surgery, which is much more invasive than a biopsy, would spread a lot more cancers. But in truth, we know that a lot of early stage diseases can be cured with surgery alone. Worldwide, millions of people undergo a biopsy, and we know that there is enough evidence to tell that biopsy actually does not worsen the outcomes, but it improves the outcomes in most of the patients. That said, there are certain indications where we can also avoid biopsies, like for example in a hepatocellular carcinoma or liver cancer, where the imaging findings are very characteristic, or in certain tumors where doing a biopsy would be very risky, for example in certain brain tumors or in some eye tumors like retinoblastoma or some testicular tumors. So these are indications where we can avoid a biopsy and we can treat based on the imaging as well as the other clinical findings that we see. So please remember this: biopsy does not spread cancer, but delaying a biopsy or the diagnosis can definitely spread the cancer. Thank you.